Hello, everyone. Thank you for joining us for today's webinar. My name is Myra Chen, and I'm your host and moderator for today's eLotus webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. Today's webinar is Clinical Success for Facial Paralysis, Parkinson's Disease, and Burning Mouth Syndrome with 40+ years of herbal mastery with Dr. Jimmy Chang, sponsored by Evergreen Herbs. Dr. Chang has over 40 years of concentrated clinical experience, treating over 500,000 patients, specializing in differential diagnosis and herbal prescription. Today's sponsor, Evergreen Herbs, is the perfect partner for Dr. Chang, as he has strictly purchased herbs directly from them for the past 30 years. His pharmacy has over 150 single herbs and formulas combined. If you're interested in starting a pharmacy just like Dr. Chang, you can order Dr. Chang's Evergreen Herbs webinar special and receive 15% off on the herbs he currently uses in his clinic. This special includes formulas such as his famous astringent complex, herbal AVX, and various classic formulas and single herbs. I'll send a link in the chat room for you to check out. This class will be presented in a similar fashion as his previous classes, so I will explain Dr. Chang's webinar for our new students joining us today. Dr. Chang's formulas will be listed in the Fang Jia Fang style, meaning formula plus formula. In addition, he will write a percentage after a formula to indicate its ratio in the prescription. Dr. Chang usually prescribes his patients 100-gram bottles or 150-gram bottles if they are not local or if the disease is chronic. Dr. Jimmy Chang, a widely known figure in the TCM community, has been instructing at eLotus for the last 2 decades, contributing to a substantial array of courses on our platform. For those interested in more pulse diagnosis, we suggest also enrolling in Dr. Chang's comprehensive Pulse Energy 1, 2, and 3 course series for foundational pulse diagnosis knowledge. For our new attendees joining us, let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone so that everyone can be part of the conversation. To ask questions during the webinar, please use the Q&A box so that the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available by the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. Jimmy Chang.
Hello, everybody. Can you hear me now? Hi. Hi, guys. It's me again, Jimmy Chen. Today, we'll be talking about some very interesting topics. And let me take this off. Facial paralysis, Parkinson, and burning mouth. This is a very funny pick of topics because facial paralysis and Parkinson are very difficult to treat. Burning mouth is a simple thing for our Chinese medicines. Anyway, there are a lot of burning stuff, burning head, burning eyes, burning ears, burning tongue, burning nose, everything. But anyway, let's start with the general ideas. The concept is that you can tell what the patient's constitutional condition is like from the patient's appearance, and then you choose your treatment strategy. Not everybody can use the same medicine. In other words, decide your treatment approaches by their body type. And of course, pulse diagnosis and blood pressure. I know some of you have never touched and never learned my pulse system, which is a little bit complicated. But anyway, sometimes I just totally relied on the blood pressure readings. That gives you a general idea what to use or what not to use. Okay. Now, this is what I was talking about. That body type, the chubby, skinny, and muscle short, normal, and jumpy, will be using different herbs because they have different conditions in their body. Even has been diagnosed with the same terminology says, well, you've been diagnosed as Parkinson, but for different type of people, we do different treatments. That's a very, very important concept. And sometimes we have to decide what's going on. Oh, Qi deficiency, the blood pressure will be low. Yang deficiency, the hormone is low. We can find it from the herbs. Sorry, from the pulses. Neutral or good people. Phlegm, dampness with water retention and what this. And in deficiency, the blood pressure is low and heartbeat rate is high. And Qi stagnation, very weak, pale, maybe a little anemic, and no energy. Damp heat, with a lot of dampness, you can find that the tongue will be very dirty and ugly. Blood stasis, you will find some blood stagnation, dark skin on the patient's mouth, I mean, the lips, face, and everywhere. Special intrinsic, another problem, is not related to the body type, it's from eating or from external interference. So different things from the different name, we have different treatment strategy. Facial paralysis. I've seen a lot in my career. I mean, lately I had a big strong guy, muscle guy with this problem, and also a very skinny young girl has this problem. I said, come on, how come you got this one when you was around your 30s, so young? They have headaches, but the most thing is the face paralysis. And this condition in Chinese means wing. Everything is wing. And wing got something to do with the liver, and liver got something to do with the mood. So the treatment will be focusing on those factors. Never mind the symptoms. That's the reason I'm putting that here is I believe a lot of things, especially something happen in the head, comes from neck and shoulder. So I always ask my patient to do this because they all are so tight. If the patient's, this is right hand side, 寸关尺, the 尺 will be like a turtle paws, then very tight, very hard. Sometimes your neck is as tight as a rock. Ooh, and a lot of pain too. So I always ask them to do this. Just lie there for 3 minutes, twice a day, or something to help to loosen up the neck and resume the blood flow to the head. Sometimes the blood flow to the head is blocked by the deformed neck and shoulder. It's very common. There's no way you cannot see it in your daily treatment. Like everybody has it. So do this will help ease your treatment. Of course, you like to do acupuncture is fine, but I don't. So I do this, ask them. Facial paralysis often refers to crooked mouth and eyes. Never mind the symptoms they're saying. But this is our basic concepts. The invasion of the wind, evil qi, and blood imbalance, and meridian blockage. So now I put the pictures here because see the darkness? That's the head with the stagnation or channel that we have to remove the blood. But by looking at this lady's ear, looks so pale, so the blood and qi may be deficient. You can check by her blood type and heartbeat rate. So easy. And this is the neck and shoulder, a little dark, so little contraction or compression or blockage to the head. This is the head, This area is the head. This cut, this groove is heart. Heart ischemia, not infraction, but obviously not enough blood supply to the head. It looks so pale. So we must do something about it. So in this case, if this lady is having some kind of a paralysis condition, Obviously, we cannot use too much cold medicine, right? Because she's already very weak. If you use too much cold medicine, even the symptom might be better for shorter period of time, and it will become worse later. And acupuncture is totally not appropriate for this kind of a weak, anemic lady. Huh? So let's get on with the real business.